The marijuana landscape in Georgia, rising potency, expanding access, and supporting recovery in our communities. And if I had to sum up one message, that's the overriding message for this, is what Sheriff Wood already said, which is that today's marijuana is nothing like what it used to be as far as potency goes, the forms it can be used in, the fact that more than half the people who use it, it's not even a plant anymore. It's semi-synthetic, it's synthetic, and it's wreaking a lot of damage to young people's brains, to addiction, to families, to congregations, to communities. It's not going forward. There we go. Okay. The organization I work for, Georgians for Responsible Marijuana Policy, we're launched in 2017. We're a 501c4 nonprofit, which means we can advocate at the Capitol. So I do a lot of talking to legislators. We're focused on, like, people hear the words responsible marijuana and they go, okay, well, which side are you on? And I have to say, we're for public health, public safety, and families and communities. That's the side we're on. Looking at us through a lens of faith and recovery communities are on the front lines. And I'll tell you what, I've been talking to faith communities almost more than any other community lately. They seem most concerned, ready to act, and seeking information and guidance, not downplaying anything anyone else is doing, but I'm really pleased with how much GRP has been able to connect with faith communities. And then recovery communities, I think that we have a growing awareness of concern that marijuana may or may not fit in the context of recovery. So faith and recovery communities are on the front lines. Youth access and mental health concerns, these are the number one things we're hearing. Addiction, relapse risk, the number of daily users. I don't know if anyone heard this statistic. Just last year, the number of daily users of marijuana just passed alcohol for the first time in history in the United States. People are seeking help for anxiety, pain, trauma, and stress. That's one of my side messages I'm starting to touch on more, is that, you know what? I'm not here just to win the marijuana advocacy battle, because that's not the real problem. The real problem is anxiety, pain, trauma, and stress. And people are going to find a way to find relief. So I'm not going to go any deeper into that today, but for context, I want to keep in mind that it's probably another reason why faith and recovery and community organizations are critical, because if we're going to go after those four words right there, it's going to take a real holistic community approach. Of course, we're concerned about pregnancy. Marijuana does scientifically show that it passes through the placenta to the fetus. We're concerned about parenting skills, connections, disconnections between parents and their kids, and family stability. And the community confusion over what's medical, what's hemp, what's CBD, what are these things? We'll talk about more of that visually here in a few minutes. Our role to respond with compassion, clarity, and connection. So it starts with, CBD. CBD and THC are both part of the marijuana plant, the cannabis plant, but they're very different. So CBD is non-intoxicating, THC is intoxicating. CBD is typically used in wellness products, and it helps some. There's still modest scientific basis for CBD support, but it does help some. We have to acknowledge that. For marijuana, our concerns here is that it does provide relief for those things like anxiety, trauma, and stress for some people sometimes. But the danger for impairment and intoxication and chronic disease that comes from marijuana, we think, are starting to outweigh the benefits it's providing. So CBD is often confused with marijuana safety. So I hear older people, young parents with young kids saying they have marijuana in the house and their gummies help them get to sleep. And they're not even sure if they're talking about CBD or THC. I'm hoping they're talking about CBD. So at least if their kids accidentally ingest those fruity flavored gummies, it's only CBD, for example. Of course, most health and safety concerns come around THC and its impact on lungs, its impact on the brain. What exactly is legal in Georgia? So, really, any meaningful conversation around marijuana has to come down, it has to start with, okay, which marijuana are we talking about? Because they're quite different, although they're converging. So let's talk about that. Recreational, we know, is when anyone 21 and older can find it almost anywhere on the street legally in your state or community. In Georgia, these came out of it's not legal. Okay, let me talk about that for a second. Marijuana has been legalized in 24 states, none in the last 2.5 years. Now, I think I just read a headline that Virginia might be changing that somewhat. So I got to update this. That might have just happened last week. But the inevitable tide that was rolling toward legalization, it's not really happened in the last 2.5 years. So we have to remember we're still confronting this as a nation. Medical marijuana is legal. Doctor certifies that you have the underlying condition. Remember, doctors don't prescribe. Marijuana is a controlled one substance. It cannot be prescribed. What doctors do state by state is they certify that the patient has the underlying condition. Doctors didn't learn about cannabis in med school and how much to dose. They might have done some work on the side, but doctors by systems don't learn about marijuana and how much to prescribe. So it's certified. Then the patient can get their card and go to the dispensary. There's 19 in Georgia right now, 19 dispensaries in Georgia, only 19 right now. They can take their card and buy anything in the store. That's particularly important because on July 1st, a new law went into effect. And where before July 1st, they could buy anything in the store, but you knew it had a THC of 5% or less. That cap was just removed. So the percent potency could be up to 95% in a medical marijuana dispensary in the state of Georgia starting last week. And other formats of medical marijuana are now possible. It used to be just the oils over on the left. Now you can put them in almost any format, including vaping. Very little medical support for vaping marijuana. Hemp consumable products are like gummies and beverages and vapes. These three things, these pictures you see, these were legalized in the state of Georgia in 2024. They're legal under a 0.3% THC, Delta 9 THC. But they still can impair. When you put them in food and smokable products, you can still get high. So while hemp was made legal in the United States in 2018, the intent at the time was to have them as an industrial product for food, for fiber, for candles. Hemp was not supposed to be intoxicating, but botanists and chemists have taken advantage of a legal loophole called the Delta 8 loophole to change the molecular structure of hemp. So now it can be just as high in toxicity and potency as Delta 9 THC. And that gets us right to number 4, which is Delta 8, and it's similar semi-synthetic products that, again, vapes, gummies, and there's a loophole. They are not covered by law. So I didn't bring, yes, I did bring. One second, sorry about that. So these beverages and gummies are available in stores. So there are 25,000 gas stations and convenience stores in the state of Georgia. 25,000. Like virtually every one of them sell alcohol. 2 years ago, when hemp consumables were legalized, they started selling hemp licenses. $250 a store. It's really low amount to be able to sell hemp products. And as of a year ago, I haven't got an update since then, 7,000 of those 25,000 have hemp licenses now. And they're not even managed by the Department of Revenue, which manages alcohol. So they're managed by the Department of Agriculture, which is struggling to get enforcement. So even the legal products, hemp products in stores it's very tricky to enforce that loophole. And that loophole is being leveraged on a daily basis. And then there's CBD, which I already mentioned, which is non-intoxicating, often used in health supplements, legal and generally non-intoxicating. Now, one of the biggest takeaways from this screen is that they all kind of merge together. I mean, I see gummies in 4 different sections. I see vapes in 3 different sections. And, of course, if recreational was legal, all those pictures would be up there too. So in the end, I mean, we're managing these things different from a policy standpoint, but from a health and consumer use standpoint, it's all THC. It's impairing, it's relieving to some degree. That's what people hope to take it for. And it's getting really complicated for the citizens to understand what are they talking about for my grandmother who's had some aches and pains. She wants to take what? And my kid just accidentally took what? And most people don't even know which 4 categories these are. And I'm sure Sheriff Wood would agree that this causes similar problems with law enforcement, because law enforcement pulls someone over, they smell something. The person says they have a medical marijuana card. I mean, Sheriff, I don't know if you're there, and I don't mean to put you on this spot, but would you like to say anything about law enforcement challenges with the different proliferation of hemp products?
It is the legal vapes for what they call CBD or low THC. It gives the same odors, and we search vehicles according to the odors we smell, and so it with Delta 8 and all these others out there, it's hard to tell what is legal and what isn't legal. We try to get even the testing by the crime lab has become an issue for them, and so they won't even test unless it's a felony amount, and it's become an issue. Luckily, our solicitor here for misdemeanor marijuana possession has contracted with a private testing facility who will test for THC levels in the marijuana that we get for misdemeanor charges, but it's getting harder and harder to find those places.
Yeah. Thanks, Sheriff. And so one of the lessons is that both at the retail level, which is managed by the Department of Agriculture, and on our roads and in the public by law enforcement, they both have an almost impossible time keeping up with hemp rules, changes, citizen awareness, compliance by retailers. It's almost an impossible place to regulate. Thank you, Sheriff, for coming on for that. I appreciate that. Georgia's experiencing marijuana expansion for the fastest and most significant in our state history. And it's happening through something called policy creep, where it starts with a limited medical marijuana, which started in 2017. We started out with just help the babies with having seizures, which is important. And, I'm frankly glad that medical marijuana is available for kids who have seizures and for cancer patients with nausea. And medical marijuana does have a lot of scientific support to support those 2 things in particular. And then the cynical side of me will come out a little bit when I share that, and the industry is using that as a door in. And then we in 20 18, the Farm Bill created hemp gummies in the United States, hemp products. Then the Delta loophole was exploited. Now states are like Georgia's expanding medical marijuana significantly and toward full legalization. So I'll give you an example about expansion of marijuana. As of a few months ago, there were only 35,000 people in Georgia who had a medical marijuana card. That's like 0.3% of the population. In Florida, 5% of the population has a medical marijuana card, over 1 million people. So if Georgia had that same percentage, if we go from 0.3 to 5%, and certainly the policy changes we just went into effect are trying to open that door. That's exactly why medical marijuana is expanding. We would have like 500,000 Georgians potentially using high potency marijuana on a daily basis. That's how much the landscape of our state could change in the very near future. So I'll tell you, if I had more time, I should have updated this slide, but this slide does start to tell the story that I got sober in 1993. In 1995, marijuana was 3.75%, the average um, um, impounded by the DEA in all their testings that year was 3.75. In 2018, it was 15.8%. And that was 2018. Botanists are getting exponentially better, and even the green leafy stuff, because this is just the green leafy stuff, is up to about 25% right now. That's not even including the semi-synthetics and synthetics, which get up to 80, 90, 95%. So this is on magnitudes of, kind of like heroin to fentanyl kind of explosion in potency. So let's go back to medical marijuana for a second. So just to describe what changes took place. Up until last week, our program was actually called a low THC program here in Georgia. It wasn't even called legally a medical marijuana program because you could only get low THC oil. Now it's called the medical cannabis program here in Georgia. We started out with 6 conditions that were eligible. Then we went to 8, then 14, then 17. This year we went to 18. The list keeps getting longer. This year they added lupus. What's significant about lupus? Now I am a compassionate person, and I know what lupus, the pain it causes the patient and their family, and I pray for them, and I hope they find relief. I'm bringing this up to say the Lupus Foundation itself does not support the use of medical marijuana for lupus. How did lupus get on this list? Under what scientific support? Tugs at the heartstrings, maybe. Severe or end stage, because medical marijuana is not FDA approved. When it came in through the door, they said, "Oh, we just want it for people who are severe or end stage." And even compassionate people like medical doctors would say, "Well, look, if they've got a few months to live, or if they're at advanced stage of their cancer, or leukemia, or Parkinson's, let's even allow them to use medical marijuana, even though it's not FDA approved." And that was true for 9 of the 17 conditions. Now they just wiped that out for all but one of them. So now at any stage, if you have that condition, you're eligible for a medical marijuana card. The risk of that is that people will start using medical marijuana much earlier in their healing process, often bypassing FDA approved and scientifically proven medications. So what we're doing significantly is normalizing marijuana as medicine without medical association support, without FDA approval, without doctors getting trained on it in med school, without pharmacists getting trained on it in pharmacy school. So is marijuana medicine? Then we should treat it as a medicine. The max potency went from 5% to unlimited. Vaping used to not be allowed. Now it is. Advertising was not allowed. Now it is. So, and again, what's the significance about advertising for adults? Small. For kids, they're going to be exposed to this on a daily basis. And of course, when kids get exposed to something like alcohol advertising on a regular basis, they're more drawn to it. It's inevitably going to happen with marijuana. It's already happening. Our concerns with medical marijuana, it's the, as I said, the number of daily users we should expect to see. Vaping further blurs the lines with recreational. You know, when I go back to that slide with 5 different things, you know, when we allow medical marijuana at 95% and it's relatively easy to qualify for a card and you can get almost as much as you want practically. And hemp is allowed in gas stations and convenience stores. How is that not recreational? We got to ask ourselves, are we already a recreational state? Medical, and importantly, again, with that blurring of the word medical, if we're gonna call it a medicine, let's treat it like a medicine. But patients hear the word medicine. What do patients assume when they hear the word medicine? They often assume FDA approved, medical association support. My doctor's been trained on this. My pharmacist's been trained on this. I can ask my pharmacist for advice, and none of those are true. So certainly medical does not necessarily mean low risk. And I think our friends from Henley would testify to that. Hemp in Georgia, go a little bit more on there. Legal in Georgia since 2024 with gummies, drinks, and vapes. Granted, you're supposed to be only 21. For anyone who is a teenager here, we know that if you're a teenager who wants to get alcohol, you can get alcohol. And the same thing's true with hemp and marijuana products. If they're in stores, there are going to be people who sell to them. And in fact, the Department of Agriculture testified in a House last year when they were doing their tests of hemp stores, they found a 46% non-compliance rate. That means almost half of every store was doing something illegal, whether packaging was not right, selling to minors under 21, etc. And it's supposed to be that delta 9 is limited to 0.3%. And in fact, it often is. I mean, when I bought this vape here in Fayetteville a few months ago, it says on the package, compliant with the U.S. Farm Bill, even though it's got like 49% THC, delta 8 THC. Also, I brought these because I wanted to make the point, and I forgot to make it earlier that, hi everyone. What I meant to say is this beverage is a THC beverage. It's a hemp consumable product. It's got 10 milligrams of THC. I don't know if you can see that. 10 milligrams. It only takes yeah, Jeff. Oh, yeah, thanks. It only takes about 2.5 to 5 milligrams for a new or occasional user to get high. So 2.5 to 5 milligrams. This has 10. Just buying one, will get you there. This vape has 8,000 milligrams of THC. So it's almost like trying to picture the distance to the moon. It's so high, it's like I can't even picture 8,000 milligrams. And these are the things that, for those of us who working with teens in recovery, these are often the things that teens are using because they're so cheap. $24.99 for 8,000 milligrams. Jeff? Yeah.
So it says 10 milligrams THC.
Yeah.
So CBD, not.
It's CBD in there too. Yeah.
Right. Is there an amount, and maybe the sheriff knows better, that a person would be considered under the influence of THC?
No. I mean, I can answer this for you. So the trick with under the influence is that marijuana doesn't work like alcohol. With alcohol, your blood alcohol content is extremely tied to your level of impairment. So when you drink alcohol and your blood alcohol content starts going up, scientifically, your impairment starts going up. And then as time goes on and you stop drinking, your blood alcohol content goes down, your impairment goes down. Marijuana is differently, metabolized differently in the body through fat and liver cells. And it can be stored for up to 30 days. So you can test positive and you haven't used for 29 days. So if they took a hair follicle and they found out that you test positive, you might not be impaired at all.
Right.
So no, yeah,
Real well.
yeah.
Like, if a person walked into the convenience store down the street from here, about how many of these would they have to drink to be a danger to themselves or others, practically speaking?
Well, okay. So the point I was making earlier is that 2.5 to 5 milligrams will get you high. So that one is more than enough. Yeah.
So it can be legal all day long, but still be dangerous.
Well, couldn't have said it better. Couldn't have said it better. Yes, sir. Lost Geek.
Okay. Well, just because I worked in rehab, we would do searches, and sometimes they sneak these vapes past you, either in packaging because it may not, may something you overlook. I know there's geek bars, but now there's one close to the name. So we've had
Want to make sure they can hear you.
Yeah, and so I just want to make sure because sometimes the ones that are THC vapes and ones that are nicotine vapes, it's hard to differentiate which ones are which, especially if they're out of package.
Right.
Because a client could come in and like, okay, here's a package, and then open it really quickly.
Right.
And then, so I've had many cases where they would get on the floor and we have to go back and search. And so just, especially with teens and stuff, like I'm a youth pastor as well. And if I see a kid pass off a vape, and I'm not aware because it's always growing. They're always changing. There's always a new one on market. I'm probably aware of Delta 8, Delta 9, and CBD, but now like it's surpassed the time that I was out there doing them. So it's like it's advancing so quickly before you can even catch up and know what's new. So
Yeah. Yes. Yes, ma'am.
And I also know, I don't know about other treatment centers, but at Hanley, we don't even allow vaping because we do not know what they're putting in it.
yeah.
So we just
Right.
say no vaping.
Great. Thank you for sharing. Thank you for the question, the comment, and the comment. And I'm not an expert, so I certainly wouldn't be able to tell the difference. I don't even know what to advise anyone. Sheriff, when you get a vape, do you make any determinations on whether it's nicotine or THC, whether it's an illegal amount? If you're there, Sheriff.
Yeah, they send it for testing, and we go strictly by the THC amount to prosecute. But,
So you do send for testing. Not every law enforcement agency is testing these days, from what I hear. Is that true?
That is true.
Yeah. I just met with Sheriff Sisk Katusa yesterday, and he wanted to get over the problem of the crime lab not testing enough, so he went out and bought his own THC testing machine. Cost $15,000. So it's a problem that it's hard to even determine what our citizens are using. Yes.
Is anyone working on a way to test impairment for marijuana? Is that happening? Okay.
Definitely working on it. Yes, Veronica.
The ingredients on the whatever that stuff is, and the Delta 8, the gas station.
Yeah.
THC, my website, but on the can it said please drink responsibly.
Yeah.
So at the same time, it's pretty much like tobacco company. Do as I say, not as I do, because I don't smoke. If I don't smoke, but I could say, please smoke responsibly. Don't get addicted to nicotine. Don't do this, don't do that. But at the end of the day, you're selling the product.
That's right. Yep.
And on the as far as testing goes, I know when Sandy Weisenbacher was our solicitor here, when Colorado? Yeah, I think it was Colorado. When they first legalized everything, that was a problem they ran into, was getting a level of intoxication on marijuana. And so they have been working on that for a while now, but no one seems to really know where to set those levels at. And that's been the biggest issue with trying to get a level set on what is intoxicating and what's not.
Yeah. We could really do a deep dive on that. That problem itself is very complicated from a workplace standpoint. Whether you should allow your employees to have positive marijuana tests because they might have a medical marijuana card. What does a workplace do? How do they treat that? How does law enforcement treat that on the roadside? Yes, sir.
I lived in Colorado. I was still in active addiction, and
You lived in Colorado when you were in active addiction.
absolutely. And so of course I partook. And even in Colorado, if you are on probation, you cannot consume recreationally or I believe medically. They had a lot of restrictions on it, and that stuck out to me. I'm like, you can consume it at a recreation use, but if you are, on probation, you can. And I know that can be like that with alcohol here also, but I don't know, it just always stuck out to me, the limitations on it. But
Right.
it's just kind of, I don't know, it's like a gray area, I guess you would say.
And
different
every
natures.
every state and every workplace is handling that differently. Some workplaces are having very strict policies. You cannot test positive, especially if you're in a safety sensitive industry like transportation or healthcare. Um, and some states, like 5 states, I think, have what they call a per se limit on roadside for marijuana. So 5 states have said, even though you can't tie your THC level to impairment, because it might be old stuff, they say if you hit a certain level, we count you as impaired and you're going to get a DWI. 5 states have done that. So, but it's not, there's some scientific grayness to that. So it's not an end solution. We hope we get there one day. We're not there yet. Yes, Veronica.
But you said, everything, just like you said, with the fat cells and everything, because I had people that would be like, oh, I haven't done it in months or things like that. And I don't care how thin they were, because that's what I used to tell them all the time. It doesn't even matter because that marijuana, the THC holds onto your fat cells, and that's what it depends on your metabolism, the way you're gonna get it out of your body. And so their thing was that. And then I told them, I said, so if you haven't even smoked in maybe, like you said, maybe the 30 days, and within that 30 days, on the 28th day, somebody said, let's go out drinking now, let's go to the club. And then they said, well, hit this. And you did that one time, it just starts everything all back over again, that cycle. And that's what I used to have to explain to them. And just like the sheriff said, even if you're on the roadside, depending on which community has what marijuana, whatever their legal practices are, or whatever their legal things are, however they measure it, then at the end of the day, the only way they're going to be able to get the screening for marijuana, because I couldn't get that unless it was mostly for hair, but if it was a blood screen when I had to do the urine. So who's gonna do the urine on the side of the road?
Yeah. There you go. Thank you, Jeff.
I'd love to hear, hey, Michael, I'd love to hear your comments, and the sheriff alluded to this too, but there was a piece of legislation in Georgia that did not really go anywhere, but it wanted to make it illegal in Georgia for law enforcement to use smell as a condition of interacting with people.
Right.
And so what are your thoughts and comments about the contradiction between some of it smells the same, but yet it's a tool for law enforcement to keep public safety?
Yeah. Well, I'll share a couple words, and I would welcome Sheriff Wood weighing in as well. But as I understand, there are circumstances where something can smell like marijuana, but it's not actually illegal marijuana. It maybe was really hemp. I think given the proliferation of marijuana products, that happens very little. That's what law enforcement tells us. And they also say that, we're not throwing people. This is what the sheriffs and police chiefs I've talked to say. We're not putting people in jail for marijuana possession under an ounce, but we still pull them over because a great percentage of the time, marijuana is associated with other crime as well. And if we didn't have that as a enforcement tool, it would really tie our hands behind our back. It's how they keep tabs on public safety to some degree. Sheriff, Give me 1 second there, sir. Sheriff, would you want to add to that at all?
No, I think that's the same thing we all run into, is using the odor test to decide whether we're going to search or not. Now, sometimes it's so strong you don't have a choice, but sometimes when you walk up to the car and they just roll the window down, and the first little smell you get does give the smell of marijuana, and sometimes just regular tobacco has an odor that's very similar. And so you have to determine at that point how far you go with it.
Got it. Got it. I think it's one of those civil right gray areas, Jeff, that we don't really know exactly where to draw the line on that. Yes, sir.
It just kind of reminds me of like, so if I have anxiety and I take my medication, it literally tells me not to operate heavy machinery. So it's like if you are driving and you have this and you know it could be illegal, it's like, well, you put yourself in a predicament. And is it the officer, is he wrong for doing what he's supposed to do? Because I think you may even say I didn't look, but like, do not operate heavy machinery. If it says drink with caution, then that should be a precaution that you take to not even have that smell coming out of your car. If it's for medical concerns, you need to take it at home because a person literally could, like, Ambien, some people take that and then they accidentally hop in their car. Now they will be put inside of a tank until somebody can maybe come and get them. So that's how I look at it because I remember when I partook in marijuana, it slowed down my reaction time. So if I'm driving and then a wreck happens, am I to blame if I am under that influence? Even though it may not be seen as a high intoxication level than a person that was at their full senses.
Right.
So it's just like, that's why I feel like it's such a gray area because when I look at it with certain meds that I shouldn't operate heavy machinery with, even if it's 100% FDA approved and I'm taking that and then I do decide to take that action, I put myself in a situation.
Yeah.
And it's like I can't blame it on this and that. I have to look at the facts of the chances that I took.
Well, and one of the themes that you're drawing out when you say this is that with marijuana, there's so much still not known because of the difficulty, perhaps researching in the past. Marijuana was harder to research in the past. That there's still a lot we don't know. And part of the reasons for potentially rescheduling marijuana, medical marijuana, is to allow more research. And we support that fully, more research. We don't think we need to reschedule to get there. We can change the laws to do more research. But at the same time, we can't say, let's reschedule to do more research. And then, oh yeah, while we're waiting for the research to come in, let's expand marijuana like this much, because then we're not using that same argument. And getting, handling some of these impairment testing questions and workplace and roadway policy questions. Our country's still trying to figure these things out. Our state's still trying to figure it out. I will say, I think I'm running a little bit good. Like I need to start wrapping up. So maybe hold questions here till the end, and I'll get through these last few slides and then welcome more conversation. In 2018, the Farm Bill legalized hemp. I won't go back on this unless someone asks a question about that. And as a result, we're seeing, I took this picture on I-75, and this is in the state of Georgia. So imagine a billboard like that on I-75, and it was there. I didn't see it the last time I was in South Georgia. I also have a video about a woman I know here in Locust Grove whose son vaped one time right before his 18th birthday, and he's got severe agoraphobia and probably schizophrenia. He's hardly left the house in 5 years. Her video, I'm not going to play the video now, but it's on our website. There's 2 videos on our website. One's on our homepage, but this is on the advocacy page, and you'll find this Kelly video. It's a 5-minute video about her son and her family. Recovery risk. Okay, so now we talk about bringing this conversation to this audience. Now, I'm not going to tell you all anything you don't already know, but I also put this slide deck together because I have to tell this story somehow. And I think I'm going to learn as much from you in these next few slides as you are from me. When THC re-enters the story here in recovery, legal or medical does not always mean safe. That's got to be one of our strongest messages for our fellows, friends in recovery. THC can become a substitute coping tool. Our friends in treatment and counseling know this. Daily or near daily use increases addiction risk. Normalization can make relapse harder to recognize. Recovery communities have a lot to offer when it comes to honesty and support and hope. Families in pregnancy, families are often the first to notice confusion, impairment. Youth and young adults are more vulnerable. We know, I think we're all starting to learn that the brain doesn't fully develop till we're like 25, 26 years old. So when youth brains are still in development, marijuana really knows how to impact and sometimes permanently change our youth brains. Pregnancy and parenting require clear, cautious guidance. It's really hard to confirm the medical harm of marijuana on the fetus. We know that the marijuana gets to the fetus. We know that there are negative consequences that come, but there are so many women who use multiple drugs that it's hard to get enough testing on someone who just used marijuana. So that's one of the reasons why even our professionals in the parenting field cannot yet definitively say that marijuana harms the fetus, but let's be careful until we know, because this is a fetus, that's, I would urge. And yet many bud tenders, the people who are selling marijuana behind the counter at the medical dispensary or the retail store, are often recommending medical marijuana for nausea for women who are having morning sickness. And why are you shaking your head?
That doesn't make
Yeah, and they're not medical doctors. So, yeah. People with anxiety, trauma, psychosis risk, and substance use history are more vulnerable. Families need help. What the faith and recovery response can be, again, you guys know this even better than I do. Compassion, clarity, connection, conversation, community. I'll be interested to hear your perspectives on a faith and recovery reaction to this conversation when I'm done. How churches and recovery groups can help educate parents. Thankfully, I'm getting exposure to more and more pastors every week, I think. Pastors want to know, they're seeing marijuana and they don't know how to handle it, and they're asking, which is great. Create safe pathways for people to ask for help early, support families navigating this. And that's one of the things I'm hearing from parents. There's a lot of parent networks. They do not know where to send their kids when psychosis or mental health becomes an issue. Parent after parent, they send their kids to 15 different treatment facilities over a 3-year period, wipes out their family savings if they were lucky to have any. It has really devastating effect with, as our friends from Hanley were telling me, it's very difficult to even establish a protocol when we're still catching up with how to treat such a thing. Is there anything else you want to add about that?
I will say. We talk about it. They still have me.
Yeah, keep going.
When doctors are going through schooling, residents and all that, just recently, they're now in the school, in the colleges for the doctors, the residency, they're learning about addiction. And that's just within the last few years. So hopefully they will be continuing to update them on things like this. But yeah, it's a very difficult situation, and that's why we do case by case.
Yeah. Even the pros in the field are still learning how to treat marijuana mental health issues. Partnering with prevention, treatment, and recovery. It's one of the reasons I love working with Seth and Andy and Jeff, because I really, my first entree into this field was in prevention. And I'm just learning that I need friends in recovery and treatment and working together, because everyone here knows what the continuum of care is between those. And when we're isolated from each other, there's not a warm passing from one to another. And that's really detrimental for the hopes of recovery. So I love the opportunity to continue these kind of collaborations. And that's it. My contact information, anyone who is in touch with me knows I welcome your questions and conversation. You can subscribe to our newsletter at the QR code on screen.